Good afternoon, Senator Bill Cassidy. Thank you so much for taking the time to meet with me today. I know your schedule is incredibly full, and I truly appreciate the opportunity to speak with you about a critical issue affecting patient safety and the future of healthcare. I also want to acknowledge your leadership on healthcare innovation and patient safety. Your background as a physician gives unique insight into how emerging technologies like AI intersect with clinical care, and I value your perspective on these matters. My name is Paul Lee, and I am a family nurse practitioner student and a practicing nurse. I work directly with patients who rely on accurate, timely, and unbiased clinical decision support tools. Over the past several years, I observed how AI has become more integrated into electronic health records, diagnostic processes, and predictive risk models. I care deeply about ensuring that these technologies help rather than harm patients. I work with a diverse patient population, including older adults, women, and minority groups, who are often most affected by biased or unvalidated AI tools. As a frontline provider, I see firsthand how these tools influence clinical decision making, workflow efficiency, and ultimately patient outcomes. Recently, I cared for a patient whose early signs of sepsis were missed because the AI-driven alert system did not flag her vitals as significant. The model was built using data that underrepresents women and older adults, which led to delayed recognition. Although the clinical team eventually identified the problem, the delay could have resulted in a preventable tragedy. This situation also creates stress for our nursing team, who felt torn between using or following AI recommendations and their clinical judgment. These moments illustrate an ethical dilemma. Clinicians are accountable for patient outcomes, yet the tools influencing those outcomes have no clear regulatory oversight. I have seen this happen in multiple cases across our hospital system, underscoring the urgency of addressing this gap. Senator Cassidy, I am respectfully asking for your support in strengthening federal oversight and transparency standards for high-risk clinical AI tools, specifically through FDA and HHS. My specific request is that you support the legislation requiring, first, bias and equity testing for all high-risk clinical AI systems to ensure vulnerable populations are protected. Two, transparent reporting of algorithm logic and performance metrics so clinicians understand the recommendations generated by these tools. Three, real-world clinical validation before nationwide deployment, ensuring that AI tools work effectively for diverse patient populations. And finally, ongoing monitoring for accuracy, safety, and unintended harm after implementation so adjustments can be made promptly. Clear standards would not only protect patients but also reduce liability concerns for clinicians and encourage innovation in AI systems that are equitable and safe. Your leadership on the Senate Health Committee, combined with your expertise as a physician, makes you uniquely positioned champion for this issue. Supporting these measures will demonstrate that Congress is committed to a safe, ethical, and transparent AI use in healthcare. Thank you again for your time, Senator Cassidy. To recap, I am asking for your support in advancing federal standards for clinical AI transparency, bias testing, validation, and ongoing monitoring. These measures will protect patients, support clinicians and ensure AI enhances rather than undermines ethical medical practice. I've also brought a one-page policy brief that summarizes these key points and actionable recommendations. I will be happy to provide your office with additional research studies, patient stories, or clinical examples that highlight the importance of these standards. Thank you for considering this important issue and for your continued commitment to safe, innovative healthcare.